Welcome to this clinical walkthrough on a cat bite case for UKMLA, brought to you by Medi8, your 24/7 practice partner. We're going to break down exactly how to handle this kind of scenario in a PLAB 2 or an OSCE setting. It's a common case, but it's got some serious potential pitfalls you need to be ready for. So let's dive in.
Here's our game plan. We'll walk through the 5 key stages of this consultation, starting with opening it, then moving into history taking, the physical exam, building the management plan, and finishing up with referral and safety netting. Following this structure is going to make sure you don't miss a single crucial step.
Okay, first step, opening the consultation. How you start really sets the tone for everything that follows. And, of course, correctly identifying your patient is a non-negotiable safety check. So it would sound something like this. You give a nice, warm introduction, you confirm the name you have on your notes, and then you ask for their full name and date of birth. This is the professional standard, and you have to get it right every time. Right. Next up is history taking. This is where you become a bit of a detective. The information you gather here is going to be the foundation for your diagnosis and your entire management plan. So, how do you actually kick this off? The way you open this part of the conversation is so important. You want to make the patient feel comfortable enough to tell you their story in their own words. This is a fantastic way to do it. You show you've read the notes, I believe you have some pain in your hand, and then you use a really simple, open-ended question like, please tell me more about it. That little phrase opens the door and lets them start talking. Now you need to drill down into the key facts. When did this happen? 2 days ago. That's a significant delay. Where? In Turkey. Your mind should immediately be thinking about rabies risk. Then, what did they do right after it happened? And what kind of medical help did they get? All of these details are pieces of the puzzle. Okay, once you've got the basic story, you must actively screen for red flags. This is how you show the examiner that you're thinking about the most serious complications of an animal bite. So you're asking about 2 groups of symptoms here. First, local signs of infection right there at the wound, like fever or any discharge. Then you move on to the really serious systemic symptoms that could point to tetanus or rabies. Things like muscle stiffness or sensitivity to light. You can't wait for the patient to mention these. You have to ask directly. And notice how direct this question is. Don't beat around the bush. You need to explicitly ask about their tetanus and rabies vaccinations. In this case, the patient is sure about rabies, but not about tetanus. That uncertainty is a key piece of information for your management plan later on. And to finish off your history, you just run through the rest of your systematic review. You've got to ask the patient about their own ideas, concerns, and expectations, what we call ICE, then quickly cover their past medical history, any medications and allergies, and their family history. This gives you the full picture. All right, history's done. Now it's time to move on to the hands-on part, the physical examination. Your examination here needs to be really focused. Think of it in 4 steps. 1, get a full set of vital signs. 2, have a really good look at the wound itself. 3, and this is absolutely crucial for a hand bite, a full neurovascular check. You're assessing sensation, movement, and blood flow. And 4th, don't forget to palpate for any reactive lymph nodes, probably in the armpit. And just a quick reminder, if you really want to get this down, you can practice this exact case right now and get objective feedback on my Medi8.com. It's truly the best way to get ready. Okay, we've gathered all our information from the history and the exam. Now it's time to put it all together and create the management plan. This is where you explain your plan of action to the patient. When you're managing the wound itself, there are 3 key decisions. First, it needs to be cleaned thoroughly. That's a given. Second, you have to decide about closing it. Now, with deep puncture wounds from something like a cat's tooth, we often leave them open to heal from the inside out. This reduces the risk of trapping bacteria. And third, you need to consider prophylactic antibiotics, which are pretty much standard for cat bites. Now let's compare the tetanus and rabies protocols. They're both important, but they're handled differently. For tetanus, since our patient's status is unknown, he's going to need a vaccine dose. For rabies, even though he's been vaccinated before, guidelines say he still needs a post-exposure course of 2 doses. And for both conditions, you can see that thorough wound cleaning is a top priority. Okay, we're on to the final part of the consultation, and it's an absolutely critical one: referral and safety netting. This is all about what happens after the patient leaves your room, and it's all about keeping them safe. You have to know when this case is too complex for you to handle alone and needs a specialist. The triggers for referral are pretty clear: severe injuries, anything on the face, serious hand bites, and patients who are at a higher risk of infection, like those with diabetes. Oh, and of course, any suspected rabies or high-risk tetanus exposure. This patient actually ticks a few of these boxes. And last but not least, your safety netting advice. This is not just saying come back if you feel worse. You have to be super specific. Tell the patient exactly what to look for, like redness spreading from the wound or if they start to feel feverish, and tell them exactly what to do and where to go if those things happen.
And that wraps up our walkthrough of this cat bite case. The big takeaways are to have a clear structure, to think about the worst-case scenarios, and to always prioritize patient safety. To put all these skills to the test, you can practice this exact case now on mymediate.com.